Thank you for letting me be here today. My name is Cindy Janssen. I am the Air Matters Program Evaluation Intern for the Tribal Healthy Homes Network. And today I'm going to recap some information from last week and dive deeper into the innovations, successes, and lessons learned from the Air Matters Toolkit. So to recap from last week, with my research, I wanted to understand the tribal and agency experience to strengthen the Tribal Healthy Homes Network support. And in addition, I wanted to hear about their innovations, successes, and lessons learned from the Air Matters program. And I'm happy to share that information with you all today. So in total, my data set consisted of 16 representatives from tribes and agencies that I conducted semi-structured interviews with. And to be eligible for this evaluation, they must have been a tribal staff member or an indoor air quality professional, as well as having ordered and distributed the Air Matters toolkits or implementing their own toolkit program. And so reflecting on my interviews, I found 4 key themes. The first being that people adapted the toolkits based on their community's needs by adding in additional tools or taking specific ones out. Second, I also found that programs specified their methods and goals. And what I mean by that is that programs clearly identified their goals, whether it be to educate or to intervene, and chose the appropriate method that fulfills this purpose. So if you wanted to spark conversations and introduce indoor air quality, education and outreach was the way to go. Whereas if you wanted to distribute the toolkits, intervention was the way to go. I also found 2 factors that influence engagement methods, which is the program type, so education and outreach or intervention, as well as the recipient interests in the toolkit itself. So if they are interested, you might delve a little bit deeper into the pieces of the toolkit, whereas some people might just want to walk away. Lastly, I found some intensities of the engagement that had varied by each program. So some had high community engagement where they demonstrated each toolkit and answered a lot of questions, whereas others were low intensity. So to go off of these 4 themes, we have seen several innovative approaches to the Air Matters Toolkit. The first being that there's a wide variety of populations, channels, and programmatic efforts who have interacted with this kit. So as we can see with the green parts of this image, these are the different methods of distribution or community engagement. So we have health fairs, schools, hospital discharges, raffles, Meals on Wheels, community engagements, the Temporary Assistance for Needy Family Program, HUD, Mold and Moisture, weatherization programs. The blue is the different target populations that they have reached. So people with asthma, youth, elderly, homeowners, renters, tribal residents and members, and then the gray are the different program types, so education and outreach as well as intervention. So one of the most interesting innovations is how people use the Air Matters Toolkit to spark conversations. For tribes who use the toolkit as an outreach and education tool, they initiated conversations about indoor air quality to people who might not know much about it. And they also encouraged people to ask questions about indoor air quality. One staff member that I had talked to mentioned that they were able to answer questions about indoor air quality that people might not open up to unless you had built up that rapport with them. And lastly, these conversations, they were able to illustrate the importance of indoor air quality and its impacts on health. So what were the successes of the Air Matters Toolkit program? So for starters, if we look at this chart for the intervention programs from a quantitative perspective, we can see that in this sample, over 90% of the toolkits ordered for intervention were distributed. And we also see successes in how broad of a reach programs get by partnering with other departments. And by utilizing your connections, the programmatic efforts were able to create the greatest impact possible. And in some cases, tribes had used these partnerships as a means to distribute the toolkits. So whether it be through HUD as a mold intervention, or as we've seen with COVID-19, one tribe used the toolkits with other departments to distribute them. And some overall impacts of the community and indoor air quality work. Each person said that they had a great experience with the toolkit. They enjoyed the cue cards and found the toolkit as another way to outreach, educate, and intervene. And several people had told me that even if the toolkit had helped just one home, then they would consider that a win. And I found that to be very interesting and hopeful because we don't have to quantitatively measure success by how many people you've distributed the toolkits to or talked with. At the end of the day, if you can just help one person, then that is success. So what are our next steps moving forward, and how do we learn from this evaluation data? Many indoor air quality initiatives adapted the Air Matters Toolkit to fit their needs of the community. So people had introduced new tools such as buckets, tote bags, or humidifier bags, whereas others took out specific tools such as the pest control kit, radon kit, or hydrometers. So moving forward, it's learning about how we can adapt based off of these communities' needs, because for one, the indoor air quality issue may not be as prevalent, or specific tools may not be practical to distribute. We also learned from a tribe who was raffling the toolkit pieces off as prizes, and this was great because the tribal members and residents were able to self-select which tools they wanted. And what we found in this community was that the high interest tools were the hydrometers, chimney thermometers, and the radon kit, whereas the low interest tools were the pest control kit, as well as the allergen pillowcase. And I just want to acknowledge that all of the pieces of the toolkit are still important, but this shows how people select what is most important and what they perceive indoor air quality to be. Moving forward, we also hope to work with the tribes and agencies in implementing behavior change assessment and evaluation tools, because only 2 people that I had spoken with had distributed surveys or follow-up conversations, and by implementing this measure later, we would have this raw data for behavior change. Lastly, we found that funding could serve as a determining factor in your method of community engagement. So some budgets allowed for tribes to purchase 1 kit for educational purposes, whereas others were able to purchase more to distribute. And there's also the component of whether or not you wanted fewer kits with all of the tools or having more kits with fewer tools in them. However, this shouldn't be treated as a constraint because programs can be successful either way. As Erin mentioned earlier, it is only one component of your broader indoor air quality work and community engagement. So thank you all so much for your time.